testing has become a very popular idea all over the country lately. There is a theory that welfare recipients are using more drugs than other people, and suddenly everybody seems to be afraid that their tax dollars are supporting other people's addictions. We need to know if this is true, and if it is, would drug testing solve the problem or save us any money? Many states have introduced bills that would require drug testing, and some states have already started testing. Florida actually tried drug testing all of the welfare applicants for a while, and the results of that were disastrous. Drug testing welfare applicants does not help anybody in any way, and it can only cause harm. There are many reasons given for drug testing welfare applicants. One reason given by Senator Jim Davis, this guy here behind me, is that welfare recipients are using a lot more drugs than other people are. That is just simply not true. Join Together staff of 2013 tells us that 8.9% of Americans over the age of 12 are using illegal drugs. They also go on to tell us that in random drug tests of Michigan welfare recipients, the numbers are not higher. And when Florida was drug testing their applicants, the drug usage was found to be far lower than in the general population. There are also a lot of people who support drug testing because they want to make sure their tax dollars aren't being spent on the drugs. That doesn't really make sense either, though, since most welfare benefits are not in the form of cash and couldn't possibly be spent on drugs. The most common form of welfare is Medicaid for children. A lot of people also receive child care assistance or EBT debit cards that they can use for food. Only a very small percentage of welfare recipients actually receive any cash benefits. Some people also think we would save a lot of money by denying benefits to those who fail drug tests. Florida, though, has actually proven this theory to be wrong as well. Loon 2012 tells us that in the few short months Florida was drug testing applicants, it cost the state millions. Now, Senator Davis, this guy here, actually has been pushing for a bill that did go through in North Carolina, 35-15. That bill actually would require welfare recipients to pay for their own drug tests before they could receive any benefits. So in North Carolina, they may actually save some money with that bill, but it's not going to be by denying benefits to those who fail the drug tests. They'll save money by denying benefits to those who can't afford the tests in the first place. It's the first I've ever heard of people being too poor to qualify for welfare. Not only is there nothing to be gained by drug testing all of the recipients, but it also violates their rights in a lot of different ways. Farlex Inc. 2013 tells us that the Fourth Amendment is supposed to protect us against unreasonable search and seizure. And Bloom 2012 says that a federal court already determined that the Florida law was violating that Fourth Amendment and forced Florida to stop the drug testing. Drug testing also violates applicants' rights with health privacy laws. If somebody fails a drug test, they would then be required to provide proof that it was because of their legal prescriptions and explain what medications they're on. Now, according to health privacy laws, as given by Health Information Privacy, you should only have to explain your medical conditions when there is a need to know. And in this case, there are no job requirements that would be affected by it. There is no reason anybody would need to know. The third way that it would violate their rights would be with the Americans with Disabilities Act. Now, this act does not cover illegal drugs, but it does cover alcoholism. And quite often, when people fail a drug test, it is because of marijuana or narcotics. In fact, those are the most common ways people fail. Marijuana is a legal medication in many states. In some states, it's even legal over the counter. Also, narcotics are legal in many states. And in the form of codeine, they don't require a prescription in 5 states, including Idaho, according to Wikipedia, April 26, 2013. So you could actually fail a drug test by using a legal over-the-counter medication, the way that many of these bills are written. And according to the Americans with Disabilities Act, you should be protected from being denied any benefits for those reasons, according to Boston University. In addition to violating the rights of these people, the drug tests really can't be believed anyway. Drug testing information tells us that most drug testing is poorly done, and that false positives can occur if the tests are not confirmed by a more expensive analysis that most labs are not capable of. Also, marijuana is the only drug that can be detected after more than a few days, and some drugs, such as cocaine, can't be detected after more than 12 hours. So the drug tests really aren't that useful. Drug testing welfare recipients does not serve any purpose, it doesn't solve any problems, and it costs far more than it could possibly save. It violates the rights of welfare recipients, and it's being done simply to punish people for being poor. Several states have tried it, and nothing good has come of it. It is a plan that can do nothing but harm. Thank you.
Good job. You held it through the distraction.